We bring you the latest updates from the Pna Newsroom. President Ferdinand Marcos Jr. maintains his stand against imposing lockdowns in the country, stressing that the current COVID-19 situation is far different from those in the past months. During his visit to the Pasig City Sports Complex vaccination site for the Pinas Lakas booster vaccination campaign, Marcos stressed the need to get boosted against COVID-19. He said this is also in preparation for the upcoming in-person classes this school year.
Ang sadya ko po rito ngayong hapon ay napakasimple lamang. Tinitingnan ko po na kung maganda at mahusay ang patakbo ng ating booster rollout na ating ginagawa ngayon. Dahil alam niyo naman po, itong COVID, masyado tayong minamahal dito sa Pilipinas, ayaw tayong iwanan. Kaya kailangan magpabakuna tayo ng mabuti dahil siguro naman nabalitaan na ninyo, maraming mga variant, yung bakuna, kung minsan kailangan isa pa para talagang tiyak tayo na hindi na tayo aabutan noong kahit na ano pang variant.
Marcos, meanwhile, said the one monkeypox case in the country has already recovered and was sent home. He said that while monkeypox is not as deadly as COVID-19, the public must still be aware of its symptoms, stressing the need to follow the minimum health protocols set by the Health Department. Health Undersecretary and DOH Officer in Charge Maria Rosario Vergere said isolation of those who exhibit symptoms of monkeypox takes up to 21 days after their symptoms have resolved, while the incubation period ranges from 5 to 21 days.
It's unfortunate that we have recorded our monkeypox case, one monkeypox. Let me stress on that. It is one monkeypox case here in the Philippines. And as of now, the patient, yung pasyente ng monkeypox ay pagaling na at malapit, umuwi na yata. Yeah, nakauwi na. So we don't have any more cases of monkeypox. But even then, I want to be very clear to everyone, this is not COVID. Hindi kagaya ng COVID ito. Hindi nakakatakot kagaya ng COVID, yung monkeypox. Parang smallpox. Para kami smallpox, marami namang gamot. Kaya pwede naman natin gamutin. Pero again, ganun din eh. Kagaya ng lahat ng sakit, kailangan malinis ang mga kamay natin. Medyo mag-ingat lang tayo sa sanitation, yung mga bagay-bagay na ganyan.
President Ferdinand Marcos Jr. has appointed Lieutenant General Bartolome Vicente Bacaro, Commander of the Armed Forces of the Philippines Southern Luzon Command, as new AFP Chief of Staff. Press Secretary Trixie Cruz Angeles said Bacaro will take over his new post on August 8. Bacaro is a graduate of PMA Maringal class of 1988. He will be the first AFP Chief of Staff to have fixed term of 3 years based on Republic Act 11709, which was signed by former President Rodrigo Duterte. President Marcos also appointed Lieutenant General Rodolfo Azurin Jr. as Chief of the Philippine National Police. Azurin, a graduate of PMA Makatao class of 1989, is currently the commander of the Northern Luzon Police and the former commander of the Southern Luzon Police. Meanwhile, longtime Assistant Director Medardo De Lemos is the new director of the National Bureau of Investigation, or NBI. De Lemos is a lawyer and career officer who had been with the NBI for more than 30 years. Cruz Angeles said the appointment of De Lemos shows President Marcos's commitment towards meritocracy in promoting and hiring personnel. After several weeks of rollbacks, oil companies are starting with the month of August with adjustments on prices of fuel and liquefied petroleum gas. Petron said it cut LPG prices by 2 pesos and 5 centavos per kilogram and 1 peso and 15 centavos per liter for auto LPG this morning. Eastern Petroleum also said it will slash Eastern EC Gas LPG by 1 peso and 70 centavos per kilogram tomorrow. With the rollback, prices of regular 11 kilogram LPG decreased by 18 pesos and 70 centavos to 22 pesos and 55 centavos this month. LPG prices have gone down for 4 consecutive months. Meanwhile, diesel prices will be rolled back tomorrow by 60 centavos per liter, while gasoline products will have a 75 centavo per liter increase. Kerosene prices, however, will go down by 75 centavos per liter. Persons with suspected monkeypox symptoms are advised to head straight to a healthcare facility for isolation. Dr. Rene De Grano of the Private Hospitals Association of the Philippines, or PHAPI, said there is no available treatment for monkeypox, but its potential spread can be limited and contained. As such, the public must be made aware of its symptoms. These include fever, headache, muscle weakness, and rashes. De Grano said isolation will begin once an individual with possible monkeypox symptoms has reported to a hospital. The public is also reminded to continue observing health protocols like wearing a face mask, washing of hands, and physical distancing to prevent the possible spread of the monkeypox virus.
Kung meron po tayong suspetsa na nagkakaroon po nitong monkeypox virus, yun po ay kailangan i-isolate kaagad. Kailangan ma-detect natin kung totoo bang may monkeypox ito. And then during the isolation, kukuha na po ng test at ipapadala po sa RITM na sa ganun po ay maalaman natin kung talaga pong monkeypox yan. And then yung pong contact tracing ang gagawin natin.
And that's the latest from the PNA Newsroom. Stay tuned for more updates on the biggest stories throughout the day. I am William Theo. Good day, everyone.